Hello all, I hope your August is off to a wonderful start. Thank you for joining our town hall today. First, I'd like to share some information about our main hospital, including commonly requested phone numbers, which show on your screen. Today's Veteran Town Hall also highlights our Oaklawn CBOC. The Oaklawn CBOC serves over 26,000 veterans per year and provides a variety of services to include laboratory and pathology, mental health care, pharmacy, and primary care. If you'd like to learn more about our Oaklawn CBOC in person, we will host an enrollment and resource fair at the clinic on September 27th from 9 a.m. to 11 a.m. Services available that day will include primary care physicals, blood pressure checks, body mass index measurements, hearing screenings and hearing aid repairs, benefits claims assistance, healthcare enrollment and resources, and My Healthy Vet Assistance. More information about this event and similar events at all of our CBOCs are available on our Facebook page. You'll find the Oaklawn CBOC contact information on your screen, and if you have any specific questions, please comment below or send us a Facebook message. We'll get back to you as soon as possible. I also want to talk about a blood drive we're having this Friday, and I want to sincerely thank our Hines VA Police and Cook County Sheriff's Office for hosting such a wonderful national night out at Hines last week. It was a heartfelt event honoring peace officers, and we also organized a blood drive that was incredibly successful, so much so that donors without appointments had to be turned away. Due to this overwhelming interest in donating, Hines is hosting another blood drive on this Friday, as stated August 15th, from 9:30 a.m. to 1:45 p.m. in our auditorium. This one will have a larger capacity than the previous National Night Out blood drive. There's a QR code on your screen. Please consider scanning it with your phone's camera to schedule an appointment to donate. Walk-ins will also be welcomed. All right, next, as we start off all our town halls, I'd like to invite up Miss Krista Dyson, who's going to share a safety story.
Thank you, and hello, I'm Krista. I'll be sharing the safety story with you for today. When reviewing a heparin infusion nomogram order, a staff member noted that the initial orders were placed and calculated using a patient weight documented in April 2025 instead of the current admission weight in July 2025. On identification of this discrepancy, it was also noted that the heparin infusion rate had been initiated using the weight from April. Additionally, the ordered bolus dose of heparin was not administered prior to the initiation of the infusion as expected. Upon identification of these discrepancies, the staff member reviewed the heparin nomogram dosing with the provider to update the calculation using the current weight obtained at admission. The staff member also worked with the patient's nurse to ensure the bolus dose was administered and the rate adjusted to the rate calculated by using the most recent weight obtained. By anticipating these risks, quick identification, and associated action, the staff member was able to ensure the nomogram orders were updated, the bolus dose was administered, and the infusion rate was updated to prevent unintended adverse outcomes that may have occurred with the ordering and administration of this heparin infusion. That concludes this safety story, and I am followed by Dr. Aubley with the Chief of Staff Medical Updates. Thank you.
Hello, and thank you for your attendance at this virtual town hall. As we're entering the dog days of summer, I thought I'd provide a few public health updates and suggestions. Probably most importantly during these warm days when people are trying to be outside more often, a couple of things that are really important. One is the use of sunscreen to prevent sunburns and ultimately the development of skin cancers. And additionally, the use of insect repellent. This is the time of year when insect bites are increasing, and it will be very important. To use insect repellent to prevent insect bites that may cause things like West Nile virus or tick-borne illnesses as well at this time of year. Finally, as we get close to the end of summer, it's important to start thinking about how you'll be getting your flu vaccination. As we start to ramp up those efforts in September and October, it's best to make a plan so that you and ideally others can get out to a pharmacy, get out to your clinics, really any place that offers the flu vaccine in order to get that critical vaccine Flu remains one of the leading causes of death for adults in the United States, and the most important preventive step that you can take to prevent it is to obtain the flu vaccine every year. With that, I will turn it over to Anthony Murrow, our whole health coordinator.
Hello, my name is Anthony Murrow, and I'm a whole health partner. As a partner, I help veterans navigate their whole health journey in various ways. So what is whole health? It's an approach to healthcare that centers around what matters to you. It empowers and equips people to take charge of their health and well-being, and it puts the veteran at the center of their health. Whole health explores your mission, aspiration, and purpose by asking what's important to you. When was the last time somebody asked you that question? When's the last time you asked yourself that question? Whole health services include orientations, taking charge of my health and well-being groups, health and wellness coaching, nutrition counseling, as well as complementary and integrative healthcare, such as Tai Chi, mindfulness, yoga, acupuncture, and chiropractic care. Next slide. You may see a blue Live Whole Health card in your waiting room or another area of the hospital. Fill it out. Share it with your healthcare team. It will help you start that conversation about what's important to you and help to discuss a goal that you and your healthcare team can share. To learn more about whole health, call 708-202-2929. And now I would like to introduce Dr. Alma Ramich to talk about addiction treatment programs at Hines.
Hello everyone, thank you for joining us today. I will talk about addiction treatment programs at Hines. We have three large addiction treatment programs. One of them is opioid treatment program, which is a specialty addiction program for veterans with opioid use disorder who are looking to reduce or eliminate their use of opiates. OTP or opioid treatment program uses medications for opioid use disorder to assist with making changes to opiate use, and the clinical provides comprehensive treatment and care to address opioid use disorder and other co-occurring conditions. We use evidence-based therapy, groups, medications, and case management. OTP has an emphasis on being able to provide same-day access to care by functioning as a walk-in clinic, being quick and efficient with getting veterans admitted into the program, and helping to provide harm reduction strategies and techniques that assist with reducing the potential for overdose and death occurring. In addition to opioid treatment program, clinic gathers feedback from the veterans in the program on a yearly basis that is then used to assist with making changes that help fit the needs of the veterans served as they work toward goals set. Hines Addiction Treatment is an outpatient specialty mental health program that provides both intensive outpatient and outpatient evidence-based treatments for veterans with substance abuse disorders and co-occurring mental health disorders. Primarily a group-based program, Addiction Treatment Program offers nearly 21 evidence-based group sessions a week, including both in-person and telehealth groups to maximize accessibility to our veterans. In addition to group therapy, our staff provides medication management, evidence-based individual therapies, and case management in person and telehealth. Access to our programs is designed with low barrier in mind, allowing traditional referral method as same-day access. We also have a Hines VA DOM substance abuse treatment program, which is a 25-bed residential unit that provides treatment informed by evidence-based practices to veterans with primary substance use disorder diagnosis, many of whom have co-occurring mental health and medical diagnoses as well. Residential program treatment includes group therapy, individualized assessment and treatment planning, relapse prevention planning, peer support services, medication management, recreational therapy, spiritual services, case management in context of therapeutic milieu. Staff strive to provide continuity of care in facilitating referrals to clinically indicated outpatient services following discharge. Eligibility criteria include being assessed as not meeting criteria for acute inpatient mental health or medical admission, being assessed as requiring a level of care higher than outpatient care or outpatient care is not available or accessible, and identified addiction rehabilitation and treatment need requiring the services, structure, and support of mental health residential treatment environment, being assessed as not imminent risk to self or harm to self or others, being capable of self-preservation, ability to protect oneself from harm, and basic self-care, able to independently complete activities of daily living such as bathing, dressing without assistance, and taking medications. Length of stay is variable, but mostly typical 28 to 35 days. We also provide services through primary care, general mental health, acute hospital, and emergency room. If you need to contact us, the best way to contact us is to either talk to your primary care clinicians or mental health to place a referral. And now I'm going to be followed by Marissa Reese, which is going to talk about baby shower on September 30th. Thank you.
Thank you, Dr. Ramage. Hi, I'm Marissa Reese, and I'm the maternity care coordinator here at Hines VA. I'm here to talk about the Hines VA baby shower for veterans. The baby shower will take place on Saturday, September 13th, 2025, from 11 a.m. to 1 p.m., and it's going to be behind the Fisher House. It's being hosted by the Hines VA Women Veteran Program, the Hines VA Center for Development and Civic Engagement, and the Hines VA Fisher House. And if you would like to donate to the baby shower, there is the QR code right there, and it's to Amazon. And please donate. We would be very, very happy with your contribution. Okay, the second slide. We would like to give a special thank you to the following organizations. The Gary Sinise Foundation. They are providing lunches for the families that come to the baby shower. Operation Welcome You Home and Veteran Voices. They're both donating a case of diapers and a case of wipes to each family that comes, and Inspired Through Flowers. Each mom is going to be getting a bouquet of flowers. Next slide, please. These are pictures from last year's baby shower. Veterans included women veterans from the VA and also male veterans from the M2VA program. We provided each family with self-care packages, baby essentials, a pack and play, and the Gary Sinise Foundation provided lunches and bouquets of flowers. We had a DJ and we had cheerleaders thanking the veterans for their service. Next slide, please. We could not have done it without the assistance of the baby shower team, the committee, this Center for Development and Civic Engagement, Fisher House, volunteers from social work, patient advocate, mental health team. We have to thank media and public affairs, the ELT, grounds, M2VA team, and the Intimate Partner Violence Coordinator, and the reproduction team. They do an amazing job. Also the veteran service organizations and employees who donated to the baby shower. Thank you, Team Hines. We really are happy that we're part of the team. And the next person I'm going to introduce is Candace Kent, and she's going to talk about the veteran experience and the Veteran Resource Center. Thank you.
All right, hi everyone. As stated, my name is Candace Kent. I'm the Veteran Experience Officer here at Hines VA. I'm here to talk to you about all things veteran experience, to include your feedback and the amazing services and resources Hines VA is offering. So, your feedback. As you know, we're always looking to hear from you, and over the past 90 days, we have received over 3,500 responses via our V-Signal survey. As you know, V-Signals is our electronic survey that's provided to veterans via email, and we're always happy to get your feedback. As always, if you get a survey, take a survey. Your feedback is very important and enhances the care we provide here at Hines VA. Next slide. And of those responses, we have over 1,500 comments. As always, I'm happy to report that almost 80% of the responses or comments we received were compliments. Again, kind of reaffirming the importance of the engagement and services you have here at Hines VA and your satisfaction with them. Additionally, 20% of the comments focus on concerns and recommendations. And as always, we use that feedback to enhance your care, looking at actions we can take to better provide care to you that impacts positively for you and your family. Next slide. And the top compliments went to the ear care clinic, interactions with staff, quality of care, nuclear medicine services, and laboratory services. So thank you, and we're happy that you are satisfied with your services within these departments, and also you're having great interactions with our staff. When it came to your concerns, you talked to us about phone-enabled services, web-enabled services, ED services, and pain management. And as always, we're working hard to ensure we improve your care in those areas. Next slide. And trust scores. So I'm proud to say that Hines VA, you all trust us with your care. We exceed national scores and business scores when it comes to trust, with Hines VA coming in at 94.8%. And as always, we're striving for 100% satisfaction from our veterans and their families. Next slide. And then trust by clinic. As you see here, all our clinics exceed 90% satisfaction trust rate from our veterans, and that just highlights the importance of the work we do in our communities, ensuring we are working with you all to increase access, and also building collaboration within the community and ensuring you trust us with your care. Next slide. So what's new? We have a lot of great things going on here at Hines VA, and I'm really excited to talk to you about a few of them today. Next slide. So Tuesday, August 12th, we had the opportunity to open up our Veteran Resource Center. We had a great turnout from veterans and staff, and the Veteran Resources really center on our veterans, ensuring we are enhancing your experience by easing access to services, ensuring you have a one-stop shop to come with questions and concerns about your care and get the support you need and the answers you deserve. This was developed to centralize and support our veterans in a way that's very unique. Kind of hearing our veterans' concerns about how hard it is at times to navigate Hines VA. We recognize the facility is very large, and so the development of the Veteran Resource Center, again, provided an opportunity to centralize the resources and support we offer here and give our veterans some answers and resources and support to better navigate your healthcare journey. Next slide, please. Then also, as always, we're looking for patient feedback. So throughout the facility, we have added various comment boxes throughout the facility. So if you see a comment box, please take an opportunity to tell us about your care here, what we're doing well, what we can do better. As always, we recognize that every veteran may not get a survey, but every veteran voices matter. So we have the comment boxes placed throughout the facility to ensure we hear every veteran and are meeting your needs. Next slide, please. And then charging stations. Of course, we know our cell phones and electronic devices are very important to us. We recognize that at Hines VA, we want to ensure that you are always charged up. So we have placed charging stations throughout the facility to include the Hines VA lobby, the cafeteria, the discharge lounge, and the Veteran Resource Center. So if you need a charge, stop by, we got you covered. Next slide. And always join us. Hines VA is always looking for you. Collaboration is at the center of what we do. And so we have a lot of great opportunities for you to join us and give great feedback. Next slide, please. Our Hines VA PFAC is a great opportunity for you to provide feedback and collaborate with our leadership team at Hines VA. As always, collaboration is key. We want to hear from you directly about how we can better enhance services here and provide you the support you need. And joining our Hines VA Patient Family Advisory Council is a great way to do so. If you are interested, please contact myself at candace.kent@va.gov for more information. Next slide, please. And next we have Jesus Molina about summer outreach events. Thank you and have a great day.
Hello, my name is Jesus Molina and I'm an outreach coordinator for Edward Hines Jr. VA Hospital. I want to highlight the upcoming events that we will be attending and hope to see you there. Sunday, August 17th, starting at 8 a.m., we'll be attending the Run, Walk, Ruck with the Veterans Assistance Commission of Kendall County, Oswego Police Department, and Oswego Fire Protection District. This is a free community event to raise awareness for veteran programs in Kendall County. Every fourth Friday of the month, from 10 a.m. to 2 p.m., Hines Outreach will be visiting the Veterans Assistance Commission of Kane County. Veterans and their families will be able to talk to veteran service officers about filing VA disability claims and receive assistance with VA healthcare enrollment. Tuesday, August 26, from 9 a.m. to 1 p.m., Hines, along with several other VA and community partners, will be participating in the annual Veterans Resource Fair with the Veterans Assistance Commission of DuPage County. Veterans will be able to receive assistance with claims, VA healthcare enrollment, record their military discharge paperwork with the County Recorder's Office free of charge, and learn about various free programs available in DuPage County and surrounding areas. I also wanted to highlight a series of enrollment and resource fairs taking place at our community-based outpatient clinics, or CBOCs. At these events, eligible and enrolled veterans will be able to receive same-day primary care physicals, blood pressure checks, hearing screenings and hearing aid repair, and assistance with My Healthy Vet registration. For veterans not enrolled, you will receive one-on-one assistance with your VA healthcare enrollment. These events will also partner with their respective Veteran Assistance Commissions and the Illinois Department of Veterans Affairs, where veterans can receive assistance with the claims process. Here are the locations and dates for the CBOC enrollment and resource events. Friday, August 15th from 9 a.m. to 11 a.m. at the LaSalle CBOC. Saturday, August 16th from 9 a.m. to 11 a.m. at the Hoffman Estate CBOC. Saturday, September 6th from 9 a.m. to 11 a.m. at the Aurora CBOC. Saturday, September 13th from 9 a.m. to 11 a.m. at the Joliet CBOC. Friday, September 26th from 9 a.m. to 11 a.m. at the Kankakee CBOC. And Saturday, September 27th from 9 a.m. to 11 a.m. at the Oaklawn CBOC. To reserve your spot, please call 708-202-8387, extension 28066, Monday through Friday from 7:30 a.m. to 4 p.m. Operators will be waiting to take your call and let them know what date you would like to attend. To learn more about our enrollment and resource events, please visit our website at va.gov/Hines Healthcare/events/. Thank you, and thank you for choosing Hines VA as your healthcare choice.
All right, thank you, and thank you to all our presenters. As you can see, we have a lot of great things going on. A baby shower coming up. Please, again, try to donate, or if you know someone that's expecting a new family member, encourage them to attend. We'd love to help get them started on the right foot. And thank you to Ms. Kent and her team. They're doing a lot of great things with Veteran Experience. And as she said, we need your feedback. So please, if you get a survey, please fill it out. We're striving for 100%. We want to make sure we're giving the best care anywhere to our nation's heroes. So thank you all for your collaboration, your trust in us. Our next town hall will be October 8th, and we look forward to sharing more information with you at that time. Stay safe and enjoy the rest of the summer.